Good afternoon. I'm Evelynn Hammonds. I'm professor of the history of science and of African and African American studies here at Harvard University. I'm also director of the project on race and gender in science and medicine at the Hutchins Center for African and African American Research, also here at Harvard. Today is the fourth conversation that we've been hosting on the historical and contemporary impact of epidemics on African American communities from 1793 to the present. So again, welcome to the conversation. All participants will have muted video and microphone during the conversation. There'll be a 15-minute Q&A. And so please post your questions using the Q&A button on your screen. Slides and recording of the conversation will be available in 1 week at the Race and Gender Science and Medicine website on the Hutchins Center website. And also after the conversation, if you have further questions, please continue to send them to also to the website. At some point soon, we're also going to have readings from each conversation that will be posted. Q&A, just to remind you, the chat function during the conversation is for comments between participants only. And during the Q&A, which is the last 15 minutes of the conversation, the Q&A function is for short questions for myself and my guest, Professor Gamble. So let's begin. The title for Professor Gamble and my conversations today: there wasn't a lot of comfort in those days, African Americans, public health, the 1918 influenza epidemic. I'm really pleased to have my good friend, Vanessa Northington Gamble. She's an MD, PhD, and is University Professor of Medical Humanities at George Washington University, where she's also a Professor of Health Policy and American Studies. She's a physician, scholar, and activist. She's an internationally recognized expert on the history of race and American medicine, racial inequities in health and healthcare, and bioethics. She's a member of the National Academy of Medicine and a fellow of the Hastings Center. And also, she's a proud native of West Philadelphia.
That's right, you have to get that in there.
I know. Dr. Northington Gamble received her BA from Hampshire College, her MD and PhD in the history and sociology of science from the University of Pennsylvania. So we begin today. As is well known, the influenza epidemic that broke out in the US in the spring of 1918, there was an estimated 675,000 deaths occurred in the US before it ended in the spring of 1919. Some familiar public health measures were instituted at the time to try to control its spread, including closing theaters and movie houses, some schools, and there are many, many images of people wearing masks in public. Just a reminder of what we are doing today. But our focus today is on African Americans in the 1918 influenza epidemic. There has been so much made in the news since the beginning of the coronavirus pandemic about its relationship to the outbreak of influenza in 1918. In those reports, we hear a lot about what happened to young soldiers, especially in Massachusetts at Fort Devens, or in cities such as Philadelphia and St. Louis, also some about Chicago. And of course, there's much discussion about the virulence of the flu in this outbreak, the large numbers of people who died, but there has been surprisingly little discussion about the experience of African Americans in that epidemic. And I'm so happy to have Vanessa here today because her wonderful article, There Wasn't a Lot of Comfort in Those Days, on African Americans' public health in the 1918 influenza epidemic, is one of the few articles that really delves into what the impact on African Americans. And you see on your slide just a couple of newspaper headlines from the Baltimore Afro-American, the Cleveland Advocate, and also Journal of the National Medical Association. For those who don't know, that's the African American Medical Association, which indicate that that the influenza epidemic did have an impact on African American communities. So To begin, Vanessa, if you could just set the stage for us. What was the health status of African Americans in the first 2 decades of the 20th century? And a little bit maybe about the burden of disease that would have had some impact on what occurred in 1918.
Evelyn, if you will go to the next slide before I do that, because one of the things that I've been asked to do a lot in the past couple of weeks is talking about the 1918 influenza epidemic and COVID-19. And so I wanted to start with some newspaper headlines from 1918 and from more recently. And you see in both of them about Black people dying. So I want to talk about that. And before I talk about health status, I want to set the stage here. And first, I want to talk about how I got into this work.
Great, perfect.
I got into this work when I was asked to write a paper. That was the paper that we're discussing today, ended up being the final product, about African Americans and the 1918 influenza epidemic. And, you know, as a typical historian, I go and look and see who else has written about it. No one. And we even went and looked in histories of, African American history. There was this silence about this epidemic in the African American community. So this is one where I had to start from Jump Street of thinking, how am I going to write this paper? And one of the things that you've asked me, and your question is, what was the health status of African Americans in 1918? And in order to paint a broader picture, I think it's critical to talk about the social and racial context of the early 20th century.
Right.
It's been called the nadir of race relations in the United States. It was the time of increased Jim Crow, a rise in white supremacy, disenfranchisement, and so also
violence and terror.
That's right, and all of that. And the reason I am bringing this up is that all of these affected the health care and the health status of African Americans. The other thing, and Evelynn, and your work really talks about this, is the medical ideology. Yes. About how Black bodies were different, how Black bodies were inferior. There were white statisticians and sociologists and public health physicians who were saying that the Black body was so inferior and so vulnerable that it would not survive in the United States. And that, so you see in the early 20th century that there are high rates of disease in the African American community. Yes. Tuberculosis has been almost like the poster child of the early 20th century. And so you also see this activism in the Black community in terms of African Americans, physicians, and social scientists saying, it's not race, meaning the Black body, that's causing these inequities. It is the social context. Absolutely. No jobs,
yes,
lack of education, lack of health care. And so, those, are some of the things that affected the health status of African Americans in the early 20th century.
Right. And I think it's really important to set that context. And as you, because I think people don't realize how much African Americans were moving during that period of time, moving from the South. It's a period of the Great Migration. As we said before, there's a lot of violence and terror. People are being crowded into various neighborhoods. And it's also a moment, which you've also written wonderfully about, when Black middle class had emerged who were beginning to address some of these issues.
Right, and and the thing is, there's also, there's a lot of talk about the Black migration to northern cities. But there is also another migration, and that is Black people moving from rural areas to urban areas in the South. So there's also that migration. But one of the things that I think is critical here is to understand that Black people responded to these health inequities. And the health inequities in terms of their not being able to get health care, in terms of their not being able to, get training. And so this slide is of, when I realized when it went up, it's another Philadelphia slide, but this is not West Philadelphia. It is South Philadelphia.
Okay.
And here is a picture of Dr. Nathan Francis Moselle, who was the first Black graduate of the University of Pennsylvania Medical School.
Mm-hmm.
He graduated from Penn in 1882.
Mm-hmm.
And when he graduated from Penn, he could not get postgraduate training in the United States.
Mm-hmm.
So he had to go to Europe to get postgraduate training.
Mm-hmm.
And what he did when he came back, he still could not get hospital privileges. So he started his own hospital. And this is a hospital that's, it was in South Philadelphia, Frederick Douglass Memorial Hospital.
Mm-hmm.
And it wasn't just in Philadelphia.
Right.
You had it in Boston. You have it, you also have it in Chicago. In fact, the first Black controlled hospital was in Chicago, Providence Hospital, that opened in 1892. And the reason I bring this up, because in the history of the 1918 influenza epidemic, you find that it's the Black institutions, it's the Black health professionals, Black lay people who took care of African Americans for the most part in 1918. Dr. Moselle, when the epidemic hit Philadelphia, and Philadelphia was one of the hardest hit cities in the country in October of 1918.
Mm-hmm.
All the beds at Douglass Hospital were filled.
Right.
And he had to have an emergency hospital on the first floor of a Black Catholic school that was close to, where to this hospital. So it's important to understand the importance of these institutions and taking care of Black people.
Should I move to the slide on the Baltimore one as well?
Let's I'll get there in a second, because the other thing too that and this is, when I wrote my book on Black hospitals, one of the things that I think it's important is to understand the role of nurses.
Ah, yes.
Like that these hospitals, for the most part, were established for nurse training schools.
Yes.
And that it was Black women in 1918, let's think about this. We didn't have antibiotics.
Right.
It wasn't even known that this was caused by a virus. Right. And what got a lot of people through was good nursing care.
And so critical.
It was, yes, it was definitely critical. But you also found Black lay women taking care of people who were sick and dying. And Evelynn, if you go to the next slide.
Sure.
This here is a picture of Providence Hospital in Baltimore. It's another hospital that was established by the Black community to take care of African Americans, but also to provide health care, and not just health care, but also a professional training.
And
One
but
of
one of the points you were making, Vanessa, though, is also that, given that the cities, that more and more Black people were moving into these cities, like Chicago and Baltimore and Philadelphia, and the hospital system was segregated. So the
oh
Black hospitals
yes,
were where people could go, right?
they were definitely where people could go. I mean, and the other thing too is that, I think sometimes people fail to understand that they were also segregated in places like Philadelphia
Uh-huh.
and in Boston. And
Yeah.
so that, I mean, and this was a time where hospitals started to be critical to healthcare and professional advancement and
Yeah.
professional training.
Yes.
And so you see here, that there were hospitals. I mean, and the hospitals were not just started by physicians.
Mhm.
You have fraternal organizations. You also had schools such as, Tuskegee Institute starting hospitals. And a couple of things about this slide. Um, and that is when I told you that when I started this project, I did not know what I was going to do. I just know I had a deadline for a paper, and so I had to find some way of documenting what was happening to the African American community with the 1918 influenza epidemic. And what I did was I used the Black newspapers a lot,
Yes.
especially the Baltimore Afro-American and the Chicago Defender. And I did that just to see, because even though these were local papers, they were also national papers.
Yes.
And it covered not just what happened in Baltimore, but also what happened nationally.
Right.
And I also looked at the Philadelphia Tribune only because Philadelphia, as I said, was one of the hardest hit cities. And this here is a quote from the Baltimore Afro-American. And what it does, it touches on the fact that the Black hospital could not take care of the needs of the African Americans who were sick with with influenza. The other thing is, the other part of this article talks about a man who was discovered semi-conscious on the in front of this hospital.
Oh my goodness.
And he could not get into the hospital because it was filled. And so they asked for someone to volunteer to take care of him in his home. But the other thing is, the African American community did was that what it did, it said, we now need to have more care for African Americans in this city. And so that once again, the African American community said, we are going to organize around this. I mean, and then the other thing too is that, I think we also have to, when we talk about this, it's that people were experiencing this from where, from positions of their race and their class and geographic location, because it was even worse for people who had the epidemic, African Americans with the flu in the South, because there were fewer hospitals for them.
Absolutely, absolutely. And so the epidemic struck, and so many people were ill. And can you say something about how the responses to, we know that the hospital population, at least the Black hospitals, weren't sufficient to care for people. So what was the other responses? In your paper, you talk a lot about what happened in Chicago. Could you say a little bit more about that?
Yeah, I mean, there are a couple of things that happened. For example, in Chicago, since most people could not get care, that you had women, club women, going into homes to take care of people. And not and when I'm talking about care in 1918, sometimes that care involved cooking,
Yes.
or going into a home and finding that that there were children there and both of their parents were dead.
Oh my
I
goodness.
mean, and so there was so those were some of the things, that, happened and not just in Chicago, but in places, all around the country.
Right. So shall I?
Yes.
Yes.
So, I mean, this is, because the other thing too is that I think a lot of times, when we talk about these epidemics, we talk about it from the position of the professionals.
Yes.
The doctors, and the nurses and the public health people. But I also think it's important to talk about it from the standpoint of lay people.
Right.
And this here is a picture of Maggie Elena Walker, who was the first Black woman president of a bank. And Luke's Penny Savings Bank, which was located in Richmond, Virginia.
Right.
And in Richmond, what they did, there was a hospital that was taking care of people with the flu, and it was an old school. A school had been transformed into a hospital.
Mm-hmm.
And in the basement is where they put African Americans. And and one day, and then later they moved to a segregated hospital. And
Mm-hmm.
one day, Maggie Elena Walker showed up with 3 other women, and she came to work. She also brought some money to help take care of African Americans. So, so that I think there needs to be more scholarship to find out, what each communities do. Because I focus primarily on Philadelphia and Chicago, but there are, other stories out there that I think are critical to understanding this. Go on.
Yeah, no, I think that's absolutely right. And as I said, I mean, there've been so little work done on this, and the epidemic was so broad across the United States. And I think it would be really important to, actually get some of the primary research on what was happening in southern cities where the availability of hospital beds was limited, and clearly in some of the broader histories of the influenza epidemic, there's a lot of discussion about the Red Cross not having enough nurses, and we have an image of Black nurses, and some of the controversy, and we can speak a little to the controversy around that. But also, I think it's really important to point out about the lay people being involved, because there was nobody else who was going to, clearly there was nobody else who was going to make the kind of concerted, organized effort to take care of all the Black folks who were actually ill as well.
Right. I mean, and the thing is, I think, even though the African American community took primary responsibility for taking care of Black people, there were some locations where white public health people did not totally abandon the Black community. And that's only because there was a saying at that time saying, germs know no color line.
Yes.
And so that you had to take care of Black people, because if you didn't take care of Black people, that they, and I'm saying this they because Black people were seen as vectors of disease, that they would infect white Americans. So that's an important part of the story. But the other thing, Evelynn, that you point out too, I think that as more scholarship is done in this, that we will find stories like in archives that that now that people are interested in there might be a letter of someone talking about this, as opposed to just focusing on newspapers. And I realized that there are limitations to looking at newspapers, but this was the first jump at looking at, some of this.
Right, for sure. So I want to turn to one of the important aspects of your paper. I mean, the paper is important altogether, but one of the things that I was very struck by, and it was exemplified by this clip from the Cleveland Advocate, February 10th, 1919. And it says, as you can see, Spanish flu shuns race, delighted. If I might read the text, reports of the flu ravished throughout the country show, it is said, that the number of colored people who have contracted or died from this recent scourge is but negligible as compared with the number of whites who have fallen victims to the disease. While it has been popularly believed that the colored race is more susceptible to pulmonary disease, it is quite apparent that the flu has not been near as destructive among colored as among white. And this represents the fact that you document so well, that while everyone, Black folks and white folks, noted that the death rate, while severe among Blacks, was not as high as among whites, but no one seemed to explain why. And as you wrote in your article, from an article in the Baltimore Afro-American, they noted, while the death rate from the epidemic is not as high as the white death rate, colored people are far from being immune of the disease. And we've just been talking about Black people were helping each other. There's clearly a high rate of disease in the community, but there's also this belief that somehow African Americans were less susceptible.
So let me explain how I came to write about this.
Mm-hmm.
When I approached this topic, I'm coming through this having done some work on looking at tuberculosis and the high rates of tuberculosis in the African American community. I had, written about people such as W.E.B. Du Bois, who were looking at social factors and said that when these social factors were improved, that the health status of the African American community would be comparable to that as a white community. So I am approaching this topic as the rates are going to be higher in African Americans. Yes. I mean, I just went in with that. And so the first time I saw that that maybe, that the rates were not as high in African Americans as it was in white Americans, it was in an oral history. And someone saying, well, Black people weren't dying from it. And I'm like, okay, that's one oral history.
Right.
And I'm just going to file it away. But then I started seeing it more and more. I mean, there was there's one article that got from the Philadelphia Tribune where someone said, the town is dead, but we are not. And so then I started seeing Black physicians saying it.
Yes.
Then, white public health people are saying it. And so I had to change what I went into this topic thinking about and saying, there's something here. And so one of the things that I decided to do was to look at the epidemic in Philadelphia and look at the Philadelphia Tribune.
Yes.
And the Philadelphia Tribune hardly had anything about the epidemic. It had some things that there were people who were dying, but that the coverage in the Philadelphia Tribune when there was a race riot a few months earlier was much more intense than it was in the epidemic. So then as a historian, I'm like, okay, what's going on here? And one of the things that, I thought, okay, maybe it's underreported, that they were not, they were not reporting, the deaths or even the morbidity rates in the African American communities in the same ways. So that's one thing. But I had to, that we will never know definitively these rates. But it was believed at that time that African Americans did not have the same rates, even by Black people.
Yes.
So
Yeah.
I had to say, okay, it was believed at that time. What's going on here? And a couple of theories, that came about at in 1918. One was that Black bodies were different. I'm not saying this. This is what was coming up in 1918. That Black bodies were different. Somehow that the noses of Black people were different, that it stopped, whatever was causing the flu. That was one theory.
Yes.
And then, Black people don't win even at a time where, tuberculosis was used as, well, there's so many rates of, there's a high rate of tuberculosis in the African American. They show that shows that their bodies are inferior.
Yes.
With influenza, that did not happen. It was, well, I have one quote when a white woman was told this, her response was, well, that shows they're not human. So it gets, to that. Yeah.
At the same time, though, I think one of the things that that was tripping people up and trying to understand it at the time was that had been well documented that there were high rates of pneumonia among African Americans.
Exactly.
Typically expected. So people said if there are high rates of pneumonia, both Black and white physicians, then the expectation was that there were going to be very high rates of influenza.
Well,
yes.
Well, Evelynn, you're absolutely right. As a historian, I went in thinking that, because I knew about, tuberculosis. I also knew about pneumonia. So that was the expectation, as a researcher that I was going to. So what's going on here? As I said, maybe underreporting.
Right.
The other thing is that there's one theory that, if you think about that there were different waves. Some historians have talked about different waves in the 1918 influenza, so that there was a milder wave in the spring.
Right.
So maybe African Americans got that, and that made them more immune in the fall, in the summer.
Right.
The other thing that I've put out there was that segregation worked as a quarantine.
Yes.
Yeah, I mean, and someone recently sent me an article from the Richmond Planet, which was a Black newspaper in Richmond, where a Black man said that Black people did not get influenza because we are Jim Crowed. And so that's
segregation, yes.
Right. And so for me, there are a couple things. One, I think we need to see whether this holds up in other cities, whether these data hold up in other cities. But I still want to bring home the point that even if it's true that the Black community suffered,
yes, absolutely,
that Black people died,
yes,
and not only did Black people die, but that they could not get the care they needed because they did not have the facilities to care for them. Right.
I want to move on for a minute to, you wanted to make a point about Francis Grimke?
Yes, this is Francis Grimke, who was head of the 15th Street Presbyterian Church in DC. It was also known as the 15th Street Colored Presbyterian Church, to make it clear who was there. And in November of 1918, Reverend Grimke did a sermon, a special sermon, and he basically said this was God's plan. That this was God's plan, this was God's plan, and to show white people that they were not superior
yes.
to Black people. And he says that it was a great lesson for white men, and it shows the folly of his stupid race prejudice.
Wow.
And that his body was not superior to the bodies of Black people. And that he used this as a call for the end of a racial hierarchy. And and so I bring this up to see how this particular African American, who was a member of the clergy, but also an activist, was trying to use this to get a political result.
Right. Because this theory of the deficit theory of Black bodies being somehow so susceptible, so weak, so unable to survive disease, based on the reporting that was happening, was upended. And so Black folks were, I want to know if you think this, but it seems to me this was a very useful way this epidemic brought to the fore that this notion of Black bodies being deficient was simply not true, and to flip it on its head.
Right. I mean, and there was even, a blues song called Influenza Blues, and, saying, it was God's holy plan and it's time for you to get rid of your shame, meaning, and so, but also was very tied into that. But I think you're absolutely right. But I just want to show, that yes. This was, that we need to find more, whether there are other sermons at this, right. Particular time, right. From the members of the Black clergy. Right. So, I mean, the thing to that one of the things about the 1918 influenza epidemic that is sometimes called, but I don't think it's going to be called that anymore, the forgotten epidemic. Right. It was for many years, it was called the forgotten epidemic, that, people would study American history, not really talk about it. And it was in large part because it was overshadowed by World War I. And even in terms of being the forgotten epidemic, historian Nancy Bristow talks about that it might have been forgotten in larger history books, but it was not forgotten in the intimacies of the family. Yes. And how people talk about it. But I just wanted to talk about a World War I. So this is a picture of Black orderlies at a military hospital in 1918. And then if you see on the next slide here, what you have is members of the Harlem Hell Fighters, who in February 1919, there were about 400,000 Black enlisted men during World War I, and about 100 Black doctors in the United States Army Medical Corps. So wow. Even though there were Black doctors, but most Black doctors stayed stateside. Yes. And not only did they stay stateside, they provided care to Black and white patients. And one of the, and after the pandemic left, they thought that they would be given their due because they showed their patriotism, they showed their professionalism, but that did not happen. Right. But another part of the story has to do with Black nurses. And so if you see, and there is a wonderful article written by Marion Moser Jones, who is a historian at the University of Maryland, about the 18 Black women who were finally able to become members of the military nurse corps.
Yes.
But after the war ended. After the war ended, even though there was, there was a need for nurses.
Yes.
They would, the American Red Cross that did the recruiting for nurses, did not allow Black nurses.
Yes.
So they did work domestically, that they worked in the communities, Black communities, and sometimes in poor white communities. And it was after the war ended that 18 Black nurses were allowed to join. And so this is a picture of some of them. So I think this is just a wonderful picture that shows, how powerful racism is, that there was a time where the Army needed nurses.
Yes.
I mean, even though these 18 were allowed, there were 3,000 Black nurses who were not allowed to be a part of the nursing corps.
And that didn't change until World War II, which we know about from Darlene Clark Hines' work.
Yes, Darlene. I mean, and one of the things that, that Marion has done, I think that is, she's reframed this and said, most of the work happened because of World War II, because of the work of Darlene Clark Hines, but that these women, that even though they had limited opportunities, they used the opportunities that they had to work for health equity. And so that what happened in World War II was on the shoulders of these particular women.
I think that's right. I think that's right. So we have just a couple of minutes to reflect a little, and then we'll turn it over to check out the questions. And this last scene is just so poignant of African Americans and COVID-19. And I've just been, perhaps you are as well, just been so moved by these images, and so disheartened by what has happened. And I know everybody is asking these questions of historians right now. What lessons have you learned? But have we learned? And but I'd rather say it in terms of what should we be mindful of based on the fact that we know this history that you and I've just talked about.
I mean, I think that's such a a much better way of asking as lessons, or the usable past. Sometimes it's you got to talk about the unusable past. But the thing is, I think one of the things about to be mindful of is that when you look at what about 1918 and looking at 2020, is who you are, where you sit in terms of your race, your gender, your class will determine your healthcare. I mean, and it's like, and then we have to think of it not just as a healthcare issue, but as a social justice issue about jobs. I mean, I was asked not a few weeks ago, what can we do to make sure they practice some social distancing? And I had to point out that they are the people delivering your food, and and working in grocery stores. So that we have to look at this as a broader way. But the other thing too is that I think when you to use your term, Evelynn, mindful, is that this reveals the fault line of American racism.
Yes. Yes.
And the impact on healthcare. So you saw it in the beginning of the 20th century, and we're now seeing it at the in the mid of the early 21st century.
Right. Right. Exactly. So I'm going to stop the slideshow now and turn it over to see what kind of questions we have. And I'm the curator of the questions, so I kind of look through and see what was what people are asking about.
Is that the word curator of the questions?
So there are a couple of questions asking about people want to get your paper. We'll certainly post the reference to your paper on our website. Um, and so, here's a question I think is sort of interesting. What was the role of the Flexner report in terms of contributing to further health inequalities and inequities? And I think the report is written about this time.
1910.
1910, right.
Well, you know, what's interesting about the Flexner report, and for those of you who don't know about the Flexner report, I'll just say briefly what it was. It was a report that was funded by the Carnegie Foundation for, and it was used as a way to highlight needed reforms in medical education. And some people say that it led to changes in medical education, but some of these changes occurred before the Flexner report. And in his report, Abraham Flexner has a chapter about Black physicians. And he basically said that Black physicians should not be surgeons, but should be public health people. That, you know, that Black physicians did not have the intellect to be a specialist, but that it was important for African Americans to go into public health, and in large part because of self-interest, that if African Americans went into public health, then they could prevent diseases in their communities from impacting of the white community. Remember, I said earlier, germs know no color line.
Yes, yes. Here's a good question, I think. Were there any positive changes that occurred as a result of the influenza epidemic, certainly with respect to African-American communities?
The short answer is no. And the reason I say the short answer is no is that this did not lead to any changes in racism in medicine. I think and that it did not lead the white community to say we need to do more. Those Black physicians who thought by being patriots and professional that they would get opportunities did not get opportunities. But I think that, and the reason I said the short answer is no, I think there's a more complicated answer, and that is that it helped the Black community to realize they needed to take care of themselves. It led to activism and continued activism around healthcare issues in the African American community. And then the other thing too, especially, and we have more, you know, because of Marion's work, we have we have a better view of some of the Black nurses, that the nurses took their opportunities and went on and worked for social equity, and then later helped to desegregate the military nursing corps. So that, but there was no overall major change.
Yes, I think it's really important to just touch on your last point, because I think what you described is, you know, and I like this point of view, is again the activism of African Americans with respect to their health, and they're you know, they are helping the community. They are, nurses are moving forward, still organizing fraternal organizations. And that is part of the lost story of this, of the influenza epidemic as well. Even if people focus on trying to understand a little bit of a conundrum about why some people have reported that the death rates of African Americans are lower, as one of the commentators said, but it didn't mean they were immune, right? And so there was a serious health issues happening at the time, and African Americans were addressing them as best they could. And that part is lost.
Right. And the other thing too is that what they did, what some of these nurses did, and some of the physicians and public health people did after 1918, what the impact might not be known for years later, but they kept the fight.
Yes, absolutely. Um, let's see. So one question is about what should Black folks be doing or demanding in terms of policies with respect to given the impact of COVID-19 on Black communities?
I mean, I think there's a lot of things that need to be done. I mean, it's heartbreaking when you see, like in Atlanta and in Georgia, 80% of the deaths are in Black people. You know, one of the things. I mean, I think that this is going to need to be multifaceted.
Yes.
I mean, I think that one that communities, you know, are organizing, and they need to be acknowledged for, you know, what they are doing. I mean, there's, you know, there are ways of looking at this scientifically. There's ways of looking at it politically. I mean, it's like, you know, continue to raise hell.
Mm-hmm.
The other thing too is, I think that this is tied up into things around labor. That who's doing particular work. I mean, I'm here in DC, and there was a protest at Jeff Bezos's house yesterday about
chairman of Amazon.
Yeah, I mean, and so I mean, I think, you know, like with COVID, there, you know, if you look at it, there's the broader societal issues of, you know, around organizing around racism, you know, people working their communities, you know, asking folks in the communities to the things like being able to have a mass.
Yes.
So I mean, I think that I mean, and one of the things that I think is, you know, as you said, being mindful of 1918 is, you know, that when we're talking about these changes, that they were done on an individual level. I think one thing that we can learn about this is that you know, that the idea that Black people are dying in this country more than white people, that we cannot let people forget that.
No, I absolutely agree. I think another part of this that your work made me think about is the fact that the 1918 epidemic, as you said, it came in stages. It started in spring of 1918. It goes into 1919.
Right.
And we all know what happens in the summer of 1919.
Exactly.
And that is one of the most violent summers of race riots in the history of African Americans up until that time. And it's so there's a question that says about asking, does the history of African American experiences in the 1918 pandemic, when viewed in relation to today's pandemic, teach us something about how the public in public health remains a contested concept? And for example, who gets to count as the public when public interests get prioritized over private interests and when they don't? And it seemed to me that the fact that there was so much racial violence when this epidemic, the influenza one in 1918, settled down, that it didn't change, or it seemed to me, my reading of it, and I'm curious to hear what you have to say, is not that then public health became a vehicle that then was expansive enough to gather all the marginal and vulnerable people under the rubric of public. In fact, it did not do that, and then there were race riots.
Right, I mean, and the other thing too is public health, you know, as it was constructed in 1918, was part of the problem.
Yes, exactly.
I mean, it was, you know, a part, you know, that you could go to the American Public Health Association meetings and hear papers about the inferiority, you know, of Black bodies, and you know, and so I mean, I think that, you know, that I think one of the things that this shows us is that, you know, I think the question alludes to is like, who is the public? I mean, I mean, and in this way, you know, that Black people were not seen as the public by people in public health. I mean, I have, you know, and they weren't hiring many. You know, I have an ad from Philadelphia where, you know, you can apply for this job in public health, um, but make sure that you are white. They took women, but you had to be a white woman. But yeah, so that, yeah.
Now, it speaks to me about looking back and
But the other thing, Evelynn, too, before, you know, and you're going to have Sam Roberts come.
yes,
I mean, and one of the things that Sam talks about that I think is critical is that in many ways, African Americans had a more expansive view of public health because, you know, you had to work with physicians, you had to work with teachers, because there were so few of you in each of these fields that you worked together, or you knew each other from your club, so that there was a more expansive view of public health that, you know, African Americans have.
And I think instead of the white public health establishment recognizing that, seeing or even validating the distinct kind of efforts consistent over time of African Americans to fill in the gaps in their healthcare, in public health efforts, because they had to, seeing that as models for what you might want to do in a larger sense. It seems to me that their efforts were downplayed and tended to be ignored.
Right. Definitely.
We could have a different model of public health if we wanted to. And it's just clear to me that it's not clear to me that many people recognize, or that even such an outbreak in 1918 would stimulate a discussion about a different kind of public health, or whether this moment is going to stimulate such a discussion. Let's see, I'll ask one last question. Okay, so when considering the growing awareness of Black maternal mortality and now COVID-19 disparities, how might mindfulness shape our thinking about reforms in medical education and the health sciences more broadly?
So, I mean, I don't, you know, the thing is, when I was, you know, when you were talking about mindfulness, I think it's like, you know, it's not mindfulness like sitting around meditating.
Right. What I mean,
mindful as you eat, to make sure you eat slowly or something like that. Yes. But it's that I think one of the things that, you know, that people do is like try to force the lessons from the past.
Yes.
So that I think that maybe a better word than mindfulness is being cautious about using the past. But I think that with the Black maternal and infant mortality rates, you know, infant mortality rates have, you know, over 100 years been twice that in the Black community than the white community, in some areas higher. I think that what both, you know, the maternal mortality and COVID-19 has shown us is that the Black community in terms of health is under attack.
Yes. Yes.
And that our lives are at stake. And, you know, that last slide was showed at the funeral.
Right.
Just, you know, basically, you know, that when we talk about this, we're talking about people dying. Right. And that is, you know, and that, yes, we have our grief, and our grief is so important, but also that we cannot forget the need for action here.
Right. Absolutely. There are a couple of questions on the chat, which are people trying to draw us into making some commentary on the differences in presidential leadership. Woodrow Wilson during the time of 1918 and Donald J. Trump in the time today. And what I recall from my studies of 1918 is that Woodrow Wilson never talked about the influenza.
This is the time of the Sedition Act, so it was hard to talk about. So he was not, there was not a lot of leadership there.
Not a lot of leadership there. And I'm not sure.
So, but Evelynn, before we leave, I just want to explain the title of the paper.
Oh, thank you. Thank you. I'm so sorry. Yes.
And I mean, and I realized that, I realized that this title, was resonating elsewhere because I saw it in the New York Times. They had quotes from the 1918 influenza epidemic a couple of weeks ago, and they had this quote.
Yes.
And this quote, I got this quote from a oral history of a Black man from Philadelphia, and he was talking about life at that time. And and he was saying, he said there wasn't a lot of comforts in those days, and it resonated with me because it wasn't just talking about the flu in 1918, but also what Black life was like.
Yes. Yes.
And
Yes.
so that's why I
Yes.
chose that to be the title of the paper.
And I think that was very apt. And as soon as I saw the title, I saw the title and I thought, who wrote that? That was your paper.
Right.
And I knew that was something we should talk about. But I do think it's a powerful comment, and it does speak to all the issues we're talking about today. So we are out of time, Vanessa. Thank you so much.
It went by so quickly, Evelynn.
I know.
I was like, well, do we have enough to talk about? I think we do. We want to thank the people sending questions.
Yes, we have many, many more things to talk about. But I really appreciate your taking time today and talking with me about these issues that we've been in conversation about for.
And thank you for organizing this whole series.
Yes, well, I'm happy to do it. So thank you again, and thank everybody for participating. And please do join us next week when we'll be talking to Sam Roberts from Columbia University.